Thanks to Vijaya and Professor David for this kind invite. I represent that part of the world where things are little different. Incidentally, I have been working there for almost 5 decades. So during these 5 decades of my service to the people as a doctor, I realized something, that I was in government, public sector, I was trained as a neurologist, I was asked to work as an anesthetist. So I had no other option. Either I migrate to USA, like many of my colleagues have been doing it, or I fight it within the system. I decided to stay back. I started giving my service to the people coming out of the government, because I did not want to spoil my learnings as a neurologist because of the wrong policies of the government, where there were, at that point of time, 30 million population in the region where I worked, and there were only 1 neurologist. So they are unable to create job for second neurologist. That's how the government functions in many parts of the world, not only probably mine. So after working there as a neurologist for almost 30 years, I realized that private healthcare is expensive. In India, only top 15% of the people can go to private healthcare providers in times of their need. 65 million people in India go below the poverty line only because of hospitalization cost. On the other hand, health-seeking behavior of the people are very poor. Most common cause of death in the hospital is they did not come to the hospital on time. This is because of ignorance, lack of health education, and at the same time, financial hardship. By the time they organize money, come to the hospital, the opportunities for treatment are over. So that's what happens in India. At the same time, the doctor-population ratio, the population-bed ratio is one of the lowest in the world in that part of the country. Not only that, maternal mortality rate, infant mortality rate, so also the average lifespan of a person in that part of the country where I belong to is one of the lowest. So what is the way forward? Then I thought that what I have seen, what I have learned, what I have experienced, I must go back to the people, meet them personally, try to relook at the problem with a fresh mind, other than what I read in the books and what was taught to me as a student. So when I did that, in the process, I had a team of people whom I mobilized, and we met about 100,000 people, trying to understand what are the problems they are suffering from. What kind of illnesses are there? What kind of hospitals and equipments are needed? What kind of doctors are needed? And how much money they can really spend, not what is available at what price in the market. And the realization of this study was that 95% of the people in that locality would be harboring at least one illness in the body. They are not aware of it. 40% of the people would be harboring at least 5 illnesses in their body, and 10% of them would require surgical intervention. So, and 70% of these diseases can be prevented. So, with this information in my mind, we tried to design a hospital, an approach to face this problem. First attempt was 70% of the diseases can be prevented. It is more important to keep people healthy and disease-free rather than treating them when they are sick. So prevent illnesses, but who will prevent it? So we created a workforce out of the community. We selected 3,000 people, mostly women, one woman representing every 1,000 people in the community, and we put them through intensive training program. It was not an easy job. We did that. We did that. They go from house to house. They give people preventive health care, how to wash their hands, how to remain neat and clean, what are the adverse effects of tobacco, alcohol, and other things. All those. So, first is preventive health care. Second, they were given health educations. We taught them, they in turn taught the villagers. From head to toe, what are the symptoms of the disease, which headache needs urgent treatment, which headache you may delay, which chest pain requires urgent treatment, which chest pain may not need treatment immediately, like that. And those who are sick, they are guided to go to that appropriate place so that they can take the treatment at minimum of cost. So that's the duty of this community health worker. We call them scistometers. We had 3,000 of them. And during COVID, these were instrumental in teaching people COVID appropriate behavior and also the vaccines resistance. That's the reason almost 100% of the people in that state, who is otherwise so much backward, had accepted vaccine, 100% of them. That was the contribution. Impressed by what we had done, USA came to support us, and they helped us to scale up the number of scistometers from 3,000 to 6,000. Not only that, what we did, we designed a hospital where, out of innovations, we could reduce the capex cost up to 30% of the market cost. At 1/3 of the cost, we designed those hospitals, starting from primary care to secondary care to tertiary care, and in some areas, quaternary care. At 1/3 of the market cost. And we were able to give the services at 1/3 of the market price. And at the same time, Ayushman Bharat scheme came, scheme for the poor people in India. Initially, we were a little bit hesitant to accept it, but later on we took it and took it forward. And as a result, we were able to very easily reach out to the bottom 30% of the people. The really poor people, our motto was that they should have zero out-of-pocket expenses. These arrangements were better than public hospital because of the fact that in public hospitals, supply is not uniform. Whenever something essential is needed, if not provided by the hospital, he has to go to the market and buy it. But in our system, we could provide everything that is needed by a patient, so he has zero out-of-pocket expenses. 80% of these patients were coming from this category of people. Everybody had a concern, shall we become economically viable? In India, most of the private hospitals are reluctant to accept patients from Ayushman Bharat because of the low tariff structure. But our model was designed in such a way that even with that much of tariff, we were profitable, sustainable, economically viable. Investors were coming and they were very, very enthusiastic in investing in GNRC's health system. So, scaling it up was not a problem. But then what we thought, universal health coverage, cashless treatment, whether it is a private hospital or a government hospital, is a must if we have to really help people. But where from the money comes? Who pays for it? Poor people do not have money to pay for that premiums. Government do not spend money for health. Indian government spends merely 2.5% of the GDP on healthcare. this budget has not increased during last couple of years. So where is the money? So we went for income generating scheme. So Assam has got 4 million hectares of cultivable land. Hardly 5% of them are irrigated. So the farmers depend mostly on natural climate. So what we have done now, we are helping them to mechanize cultivation, increase production, increase household income, improve the per capita income of these people, and a portion of that would be saved for a healthcare expenditure of the community. That's what we are doing. And third, whenever there is a government scheme, we try to leverage on it and help the people as much as possible. So basically, the GNRC's approach is more emphasis on preventive and promotive care. Second, wherever possible, you leverage the government scheme, work with them, but there is always a risk associated with it because of the inconsistent approach of politicians. It depends on their mindset. And third, probably income generation would be a better solution for us, then things will remain within our control. Whoever needs, we can give it. There will be no delay in payment. That's what we are trying to do. So this is, in a nutshell, GNRC's approach to the health system. We are running this scheme for last 10 years. It is economically viable, profitable, and at the same time, we are able to give healthcare services to the people who deserve it most. Thank you very much.